This video has been produced by the Sheffield Community Learning Disability team. The video explains our eligibility process. This is how we work with people who have not accessed the service before. When someone is referred to the Community Learning Disability team who we have not met before, we check the person meets our criteria. We work with people who live in Sheffield. The person must be registered with a Sheffield GP to access support. The person must be aged 18 to 65 when they are first referred to the Community Learning Disability team. If the person is under 18, we will advise them on how to access support from other services. This might include social care, Sheffield Children's Hospital, CAMS and Reigate Children's Centre. The person must have a health need which cannot be met by other services, such as their GP, social care and other health teams. If the person's needs would be better met by another service within Sheffield Health and Social Care or other health teams, we will encourage the person to access this service. This is because people with learning disabilities have a right to access the same services as everyone else. Reasonable adjustments may be needed to support the person to access services. We need the person's consent to take a referral forward. Professionals and carers are able to refer to the Community Learning Disability team on the person's behalf. The referrer should speak to the person about the referral and agree the referral with them before contacting the service. In cases where the person does not have capacity to consent to the referral, the referrer should explain why the person did not have capacity and show that they have agreed the referral with the key people involved in the person's care. If the person meets the first 4 criteria, then the Community Learning Disability team may be able to help. Next, we need to check if the person has a diagnosis of learning disability. This is because we only work with people with a learning disability. The person might have been diagnosed with a learning disability in the past. In this case, the referrer should provide evidence of past assessment. If the person does not have an existing diagnosis, then the referrer should share the reasons why they suspect the person may have a learning disability. When we ask for evidence of learning disability, we are looking for signs that the person meets the following criteria. The person's intellectual functioning is severely impaired. This is the person's ability to process information and solve problems. The person's social adaptive functioning is severely impaired. This is a person's ability to do everyday tasks independently and keep themselves safe. The person needs to have been experiencing both of these things since before the age of 18. All 3 criteria must be present. The best way for referrers to provide evidence of learning disability is by completing our referral form. The referral form contains prompts about the information that is helpful for us to know. Referrers should also enclose copies of any past health and social care assessments with the referral. Sometimes, other conditions are mistaken for learning disability. Before making a referral, consider whether the person's difficulties may be related to one of the following. Someone who had difficulty learning in school with no associated causes or disability. Someone whose difficulties are related to a specific learning difficulty, such as dyslexia, dyscalculia, or specific language impairment. Someone whose difficulties are related to emotional difficulties or disrupted schooling. Someone under the influence of long-term alcohol or substance abuse. Someone with a brain injury that occurred after the age of 18. Someone with a physical or mental health problem that affects their functioning. Someone with a sensory impairment or physical disability. A person with ADHD or hyperactive disorder. Or a person with a diagnosis of autism who does not also have a learning disability. Around 1/3 of people with autism also have a learning disability, but many do not. Sometimes we need more information about the person to decide if the community learning disability team is the right service for them. We need to do an eligibility assessment. This means finding out if the person is eligible for support from the service. Do they have a learning disability? We invite the person to an eligibility screening. This can be a face-to-face appointment, over the telephone or over video call. The person can bring a family member or carer with them. We ask questions about the person's health, childhood, schooling, what they can do independently, and what they need support with. The appointment takes around an hour. We might be able to say if the person is likely to have a learning disability after one appointment. Sometimes we cannot make a decision right away. We may need time to discuss the person's assessment with other members of our team. We may need to invite the person to complete further assessment. We might need to learn more about how the person thinks, their cognitive functioning. We might need to learn more about how the person manages daily living tasks, their social adaptive functioning. After an eligibility assessment, if the person has a learning disability, we talk with them about their needs. They can still access support from their GP and other health and social care services. If needed, we can advise services on how to make reasonable adjustments for the person's learning disability. If support from the community learning disability team is needed, we make sure that the right people from the service meet with the person. There might be a wait for support. If the person does not have a learning disability, we will talk with them about their needs. We will signpost the person to an appropriate service where possible. If you or someone you care for has a health need which you feel would be best met by the community learning disability team, please make a referral. We accept referrals from professionals and self-referrals from the person and their carers. If you are referring someone else, please discuss the referral with them first. Make sure that they meet the criteria mentioned earlier in this video and that they consent to the referral. If the person does not have capacity to consent to the referral, you should be confident that the referral is in their best interests. Where possible, we advise that you speak to a referral coordinator before making a referral. Call us on 0114 226 1562 or email us at cldtbusinesssupport@shsc.nhs.uk. We will send you a referral form to complete. For more information on the support the Community Learning Disability team offers, please see our team leaflet or the Welcome to the Community Learning Disability team How to Access Support video. The Community Learning Disability team is part of Sheffield Health and Social Care NHS Foundation Trust. We offer 24/7 telephone support for urgent mental health support, advice and triage. Call 0114 226 3636 if you require urgent mental health support for yourself.